I'm here with Dr. McAnulty and also John Brogden to talk about mental health issues from Lifeline. So to 8 p.m. last night, there were 131,174 tests, and from those tests, there were 1,533 locally acquired cases of COVID-19. There are now close to 11,000 people with COVID-19 who are currently being cared for by New South Wales Health. The vast majority, about 90%, are being cared for at home, in the community, or in New South Wales Health's special health accommodation. There are currently 1,041 COVID-19 cases that are being managed in our hospitals, and there are 173 people in intensive care, and 62 of those people in intensive care are requiring ventilation. I want to stress the importance of vaccination yet again. When we look at the number of people in our intensive care units, of the 173 people in ICU, or intensive care units, 137 are not vaccinated. 29 people have received just their first dose of a COVID-19 vaccine, and 7 have received 2 doses of a COVID-19 vaccine. Very sadly, to 8 p.m. last night, we have had 4 more people pass away. We had a gentleman in his 60s who died at his home, and he was from Western Sydney. We had a lady in her 80s from southwest Sydney. She died at Fairfield Hospital. We had a gentleman in his 50s from Western Sydney who died at Westmead Hospital, and a gentleman in his 70s from southwest Sydney who died at Liverpool Hospital. Just want to express my condolences to each of those people's families and friends. Passing of a family member or a friend is always extremely sad, and I just want to really express those strong wishes to each of the community members who knew those people, and to just say we're thinking of you. Sadly, none of the 4 people who passed away were vaccinated. The good news, though, is New South Wales residents are still getting out there and getting vaccinated at a great rate of speed. There were almost 130,000 vaccines yesterday administered in New South Wales. Almost 50,000 of those were administered by the New South Wales Health team, and the balance of the other cases were administered in pharmacies and general practices. I stress there are a range of avenues for you to get vaccines. Right across New South Wales, there are pharmacists and there are GPs with vaccines, and of course there are also the state established hubs and centres, and there should be one near you. Book in and get a vaccine. If you are not vaccinated, book in and get one. 72% of people aged over 16 now have received 1 dose in New South Wales, and just shy of 40% are fully vaccinated. So 39% are fully vaccinated. I want to thank the community more broadly across New South Wales for getting out and being part of what is a great journey to beat this virus, to get vaccinated. It's the way forward. Tomorrow we're going to have a Super Sunday vaccination blitz for all police, fire and emergency services personnel who live in those 12 LGAs of concern. We're obviously very, very concerned as a government and as New South Wales Health to make sure that we have all of our frontline workers vaccinated. And so tomorrow is a very special day, and I would just say to those remaining, many of the emergency workers have already been vaccinated, but if you haven't been, tomorrow is your golden opportunity to go and get vaccinated. And you can go through nsw.gov.au And there's also links that have been sent to many of those workers from their employers. I want to stress also that healthcare, hospital and aged care workers from these 12 LGAs of concern can also book in. So I stress healthcare, hospital and aged care workers can also book in for that Super Sunday tomorrow. The participating vaccination hubs for those workers are at Sydney Olympic Park, at Bankstown, at Macquarie Fields and Prairie Wood. And as I said, you can go through nsw.gov.au or the link that has been provided by your workplace. Now, obviously, and I'll ask Dr McAnulty to give more detail on this in a moment, obviously, and unfortunately and sadly, the majority of our positive cases still continue to be in southwest and western Sydney. As I said, he'll give the details of the numbers and the suburbs. But we all are still having cases across our regional areas, particularly across the far west of New South Wales and across western New South Wales. Through the western New South Wales local health district is much closer to Sydney. Far west is obviously Broken Hill and the area more towards Broken Hill. In the western New South Wales local health district, there were 38 new cases of COVID-19 reported to 8 p.m. last night. Unfortunately, that does bring the total cases in that local health district, that western New South Wales local health district, to 759. The 38 cases that I just referred to, the majority are in Dubbo, 22 cases. 9 were in Burke, 3 were in Bathurst, 3 were in Orange, and 1 in Bogan. To 8 p.m. last night in far western local health district, there were 9 cases, 9 new cases. All of those 9 cases are in Wilcannia. This means that to this point we have a total in that far western local health district of 107 cases. I think there are 97 in Wilcannia and 9 in Broken Hill. And I think there's also 1 case that I referred to earlier in the week that's now in Queensland. There are 15 new cases across the Hunter New England local health district to 8 p.m. last night. And that brings the total in that district, the Hunter New England district, to 218 since the 5th of August. 10 of the new cases are in the Port Stephens local government area. 1 is in the Lake Macquarie local government area, 1 is in the Newcastle local government area, and 3 are in the Maitland local government area. There are 17 new cases reported to 8 p.m. last night in the Illawarra, and that brings their local health district to a total of 140 cases. Those 17 cases, there were 12 that were actually in the Wollongong area. There were 3 in the Shell Harbour local government area and 2 in Shoalhaven. There were also, in the Central Coast area, there were 15 new cases, and that takes the total number in that district to 93. I want to stress that the way forward, and it's a very positive way forward, is to get vaccinated. I want to thank all of the citizens in New South Wales who have gone out and done what you need to do for yourself, for your family, for your friends, for New South Wales and indeed Australia, and got vaccinated. And I want to say to those who are still hesitating, there is no reason to hesitate. There are very good vaccines available here in New South Wales. There are an abundance of venues where you can get vaccinated, and it is absolutely crucial that for us to get back our freedoms as quickly as possible, for us to be able to get back to our normal way of life, or as close as possible in a COVID environment, you need to get vaccinated. So please, please do that. Please take up the opportunities that have been offered in so many places. Now I'm going to ask Dr McAnulty to add some more to what I've already said. And then I'm going to ask John Brogden from Lifeline We do know that this period of lockdown, this period of COVID has brought additional stresses on us all. There's no one I know that has escaped that stress. And some of us respond in different ways to that stress. Lifeline can offer you assistance, and John will actually talk about some of those stresses and the assistance that can be offered. So first of all, Dr. McAnulty.